Weekly testers drop off their COVID-19 test kits at University City High School. This is motivated by the idea of weekly screening testing for COVID-19 at schools, a recommendation from last year by the CDC.
Doing weekly screening testing is a recommended strategy by the CDC at limiting the amount of transmission of COVID-19 in schools. We need better data. We need more data to say, is that true? Do we really need to go this length of adding another layer of mitigation?
To find out, pediatric infectious diseases physician Dr. Jason Newland launched this research project for the 2021-2022 school year. He established the Safe Return to School study at Washington University School of Medicine in St. Louis with weekly testing locations at participating schools in North St. Louis County. University City High School is part of the study offering weekly screening testing. Students, staff, and their families can choose to enroll.
I smile when I hear about the partnership with Washington University, as Dr. Jason Newland and his team have been incredibly supportive, and we've worked together as a team. They are visible, friendly, and professional and welcoming, and because of the positive spirit and the way that they have embraced our school community, I think it's helped boost participation in the study and increase trust around mitigation strategies and science as it relates to the pandemic.
The project is part of the Safe Return to School Diagnostic Testing Initiative funded by the National Institutes of Health.
The description from the National Institutes of Health was to do an underserved population, and we wanted to really focus in on our predominantly African American school districts, as we wanted to understand and provide more access to testing to these areas.
Newland is focused on schools north of Del Mar Boulevard. The study refers to it as the Del Mar Divide. U City High School is one of 8 schools and middle schools in 5 North County school districts participating in weekly screening testing for asymptomatic infections.
The goal of the study, number one, was to determine if weekly screening testing was best at limiting the amount of transmission of COVID-19 in schools.
Just inside the front doors of University City High School, the Washington University School of Medicine team is collecting test kits once a week from volunteer study participants. They're doing this every week for the entire school year. The test kits contain saliva samples ready for COVID-19 testing.
Staff or students or household members will drop off their test kits in the morning, so usually very early in the mornings before school starts. And then we'll bring them to a separate place where we'll process those tests. So we'll pick up if they have any quarantine or any symptoms. We have a weekly testing form that has all that information. And then we'll just put in the date and time they took the test, and then we'll scan in those test tubes.
Saliva testing is then done inside this Washington University research laboratory. In the 5 school districts, there are a total of 16 schools participating in the overall study by offering school and community testing for those who have symptoms.
For anyone who might need a test, we're in the parking lot. It's free. We try to make the process as streamlined as possible.
It incorporates so much community partnership. We partner with different community organizations. We have a community advisory board where we get input in from staff, students, and their parents about what we're doing.
Newland's primary goal was to provide scientific evidence about weekly screening testing for schools. But that takes more people.
Really, to understand that best, you need to have as many people participate as possible, which just has been challenging. I don't think doing it through a consented-based research project is the way to do it. I think it's just too hard. I'm glad we're doing weekly screening testing. We're hearing a lot of positive responses from those participants in weekly screening testing, but we're unable to do enough that I think would make this useful for everybody to really understand things.
University City High School has the most participants, but it's still not a lot.
We'll probably test around 80 to 90 or so tests at specifically only U City High School each week. And we have about 150 participants overall at the high school.
But since this particular day in December, study participation has risen with the surge of COVID-19 cases from the Omicron variant.
It benefits us by keeping us safe. The sooner we know of any positive cases, the sooner we can implement contact tracing and quarantines if necessary to ensure the safety of all of our staff and students.
This type of positive feedback is why Newland says the study is providing valuable insights for recommendations, even though the number of people doing weekly screening testing isn't what they had hoped.
These individuals participating are so appreciative. they are thankful that they can actually get tested and know that it's safe, and they feel that their school is safer by knowing that there's some ongoing testing that can help identify that. So I think there's ways of looking at this at, yeah, maybe you do offer weekly screen testing. Maybe you offer it to household members if you have the staff and can do that, because you're providing a service that creates a better climate, better culture for your school.
And when people have symptoms or exposures, he says they want access to testing.
The fact that they can get a test on the Monday before Christmas, right? Like, we had so many people get tested in 2 days. We were able to offer testing because it was there and they didn't have to worry and they could go get it. Like, I think that's another take home is we need just more access to testing, that it's not a hard process to do, because that limits people from getting tested.
Newland says another discovery from testing in this study is that about 70% of positive cases of COVID-19 are unvaccinated people. Newland plans to continue the safe return to school study next school year, but he has plans to change the study for improved results.
Phase 2 is still under development. It's going to include probably some more testing and probably a big focus on vaccination. We talked about is, do we target like high risk things, right? High risk groups. So if you're in an indoor sport, maybe that would be a group that needs to be weekly tested during their indoor sport. It's important for the next pandemic. If there's anything in what we end up publishing, it will be like, okay, here's what we would say for the next pandemic. One, make sure you test, make sure testing is easily available, and offer it, because people are comforted by knowing if they're positive or not.